Hi, everybody. We are going to go ahead and get started. Um, for those of you who are just joining us here, this is a webinar put on by the WFSA on making a global impact in anesthesia, how to get involved with the WFSA. We're thrilled that you're here today. For those of you who don't know me, I'm Faye Evans. I'm actually a pediatric anesthesiologist at Boston Children's Hospital in the US, but I'm also the director of programs for the WFSA. And I'm here with my co-moderator, Louise Falco, who is also an associate professor and chair of anesthesia at the Federal University of Sao Paulo in Brazil. And he is also the WFSA Director of Memberships. And we're just thrilled that you took the time out of your day to kind of come and hear about ways that you can get involved in the WFSA. We realize that many of you have always wanted to get involved and are always asking the question, how do I join? And honestly, it's just a reminder that you, as a member of your national society, if your national society is a member of the WFSA, then you are a member of the WFSA. Just a few housekeeping things before we get started. There is a Q&A, and you can contribute any questions you want through the Zoom Q&A function. We'll try to answer them. If we can't do it on live, we'll try to answer them on the chat. There is translation available. It uses Zoom's AI translation feature for live subtitles. So make sure to select your preferred language in the settings, and that's the icon to find the translation option. Uh, there are certificates of participation that will be issued within 15 business days of the webinar. To qualify, you just need to attend for at least 60 minutes. And the webinar will last somewhere between 60 minutes to an hour and a half, just depending on the questions that we have. And then finally, this webinar will be recorded and it's going to be published on the WFSA's virtual library. So if you have to leave early, or if you know somebody who wanted to attend and couldn't, let them know. And a link will be sent to your email, but it'll also, again, be available on our virtual library. This is the program. It's packed full. Um, Luis is going to talk about why you might want to get involved with the WFSA. And then we have short presentations by a host of people who've been leaders in different areas, including committee work, our short courses, our publications. Nicolas is going to be talking about regional involvement, and then Francis is kind enough to talk about advocacy and communication. And then we'll finish up having a formal Q&A session, but we'll get into more of the details as we get going. So really, I'd like to go ahead and get started. And Luis, I'm going to let you kind of take it from here.
Thank you very much, Faye. So welcome everyone to this so important webinar. And I will talk for the next 5 minutes why we need to get involved with the WFSA. So I will share my slides. Faye, could you please confirm if you are seeing my slides?
I see them perfectly.
Okay, thank you very much. So why we need to get involved with the WFSA? So first of all, we need to understand a little bit who is the WFSA. WFSA was founded in 1955, and today WFSA has 142 member societies, which represent more than 150 countries, with approximately 500,000 anesthesiologists. And it is very, very important. And today, the WFSA is led by volunteers. The vision of the WFSA is a universal access to safe anesthesia. And the WFSA mission is to unite and empower anesthesiologists around the world to improve patient care. WFSA has 5 strategic priorities, which is to champion the vital role of anesthesiologists in a global and planetary health, strengthen member societies, and enhance professional networks, advance anesthesiologist leadership within healthcare, work with member societies to ensure a well-trained and resilient workforce, and improve safety and quality in anesthesiologists. It is important to understand that those all 5 strategic priorities are equally important. And why get involved? When you get involved in the WFSA, you are part of a global community. It's a truly global network. We have opportunities to contribute to education, safety, and advocacy with a network with colleagues from around the world and make a real impact on patients' lives globally. Only for an illustration, last year in 2024, we can see the global impact. About our family, in the World Congress of Anesthesiologists, we have in person more than 5,000 participants from those 142 member societies. Inside the WFSA, the committees of the WFSA, we have 54 different nationalities. In the digital learning, we have more than 500 users on the SAFE course, almost 24,000 registers in the WFSA webinars. And in the tutorial of the week that we will understand a little more later, we have almost 1.5 million views. So just highlighting a few programs, we can understand a little more about these programs in the next presentations. The SAFE course, training in obstetric and pediatric anesthesia, the WFSA fellowship programs in the subspecialties as obstetric and pediatrics and pain, for instance. We have the digital learning with the tutorial of the week and the updating anesthesia, which is our open access clinical education. The WFSA has the mentoring program supporting the early career anesthesiologists, and today with more than 300 mentors and mentees enrolled in the program. And the World Congress of Anesthesiologists promotes science, education, training, networking, and with the potential of exchange experience. On the advocacy, WFSA has a global and regional impact level. WFSA has an official relations with the World Health Organization. Last year, WFSA participant of 8 different events of the World Health Organizations with more than 18 statements on the behalf of the member societies. WFSA has a consultative status with the United Nations Economic and Social Council and the advocacy of many different topics as a workforce well-being, the capnography gap, PBM, the patient blood management, the global health emergencies, climate and health, and any others. And this advocacy, it's interesting because we have the consistent messaging. We uniting and amplify the voice of anesthesiologists, advocating for resource to increase the availability, accessibility, and the quality of the anesthesia care, and for safety, championing for international anesthesia practice and standards. We have as an example the WHO WFSA international standards for a safe practice of anesthesia. So why it's worth it? Because none of us is as strong as all of us together. And the WFSA offer to us a purpose, belonging, and impact. So by getting involved, we transform anesthesia in ourselves. It is important to get involved with the WFSA. Your voice matters, and your involvement makes a difference. So now, following this webinar, we have, as Faye mentioned before, we have 6 presentations to understand, just a short presentations, to understand a little more a few important programs of the WFSA. And I would like to present our first speakers, Dr. Sheila Myatra. Dr. Sheila, she is the chair of the WFSA Intensive and Critical Care Medicine Committee. Dr. Sheila, she's a professor at the Department of Anesthesiology, Critical Care, and Pain in Tata Memorial Hospital in India. So, Dr. Sheila, thank you very much to join us. And now I'm hand over for you.
Thank you very much, Luis, for that very kind introduction. I'm going to be speaking about the WFSA committees. And Luis has already spoken about the strength of WFSA. And we have the WFSA committee. As of now, we have 11 committees. And each committee is led by a chair. And there's also a deputy chair. And there are members of the committee. Now, the WFSA committee is a main source of support, expertise, and guidance for the WFSA programs and activities. So it's a very integral and very important component of the society. And as a member, one must at least have expertise or be interested in contributing and be committed to the mission of the Federation. And the term is of 2 years, and nominations are invited, and you will hear about this very soon. Every alternate year, and then there's, whoever's they're shortlisted, and then there's a selection interview that takes place. And as of now, the committees that are present in the for the WFSA, the 11 that I mentioned, are the Constitution Committee. And this committee looks after the governance of WFSA, reviews the various revisions to the WFS Constitution documents. We have the DEI, Diversity, Equity, and Inclusion Committee. And this seeks global, works towards global awareness about DEI and also tries to develop strategies to advocate for stronger DEI. We have Education Committee that looks after and tries to strengthen the educational activities of the WFSA. And we have the Intensive and Critical Care Committee, which I chair, and the function of this is to look and to improve at acute life-threatening conditions, and especially in the perioperative and post-operative, and also need for other operative care, even outside of the perioperative settings. We have the Operative Anesthesia Committee, and this looks at providing support and training for anesthesia practitioners, both medical and non-medical, who care for pregnant women across the globe, and particularly in resource-limited settings. Then we have Pediatric Anesthesia Committee, and this again looks at support and training and education for anesthesiologist practitioners who look after children and babies, and again with a focus on resource-limited countries. Pain Management Committee looks at education and training for anesthesia practitioners with a focus on pain management. We have the Safety and Quality Committee, and this functions to promote the highest standards of safety and quality in anesthesia internationally. We also have the Civic Program Committee, and this tries to facilitate cooperation between various member societies and looks at various scientific programs, including that of the World Congress. Sustainability Committee, the Sustainability Committee engages with the WFS and other some societies and peer medical associations and looks at sustainability in anesthesia. And last but not least, we have the Workforce Wellbeing Committee. And this is a very important committee. And this intends to create awareness of the impact of occupational stress among in our specialty, and various strategies by which we can look at workforce well. Details of these committees are provided on the website, and you can go through it. But what I'd really like to talk to you about is what are really the pros and cons of being a member of the committee. I'll start with the downside. If you look at it, well, you have to give time to this. And you may have meetings, and most of the work is usually online, and this may be any time in the day or the night, because we work with people who are from different time zones. And of course, there's no remuneration for the work that you're doing. But these are small things. A person who joins the committee is usually someone who's very passionate and wants to serve the WFSA. Now, if you look at the pros, let me think about what is important from what I look at it. Well, it's very nice to have on your CV. No, I'm just joking. This is not the only reason to be a member of the committee. There are many, many advantages. And Luis has already talked about the global and diverse representation of WFSA. Now, each of these committees have members from different parts of the globe. And I think this is a real strength of the various committees, because you get to interact with people from all regions of the world, not only from your committee, but also from the other committee. The way I look at the WFSA is it's really like a family, and right from the leadership to the council and the board members, they're really very supportive and try to promote the various ideas that the committee members put together. So if you're passionate, you have some idea, even within the committee, we work as a team, and you can really take it forward. You may be very actively involved in your local anesthesiology society, but whatever activities you do, you can now partner with other member societies and take this forward in a bigger way. Not only the networking with other member societies, but also collaboration with other non-anesthesiology societies. The way I look at it is that the WFSA is a real strong voice for anesthesiologists. And together we can really make a difference. And being on a committee gives you that power to interact with other people and, strengthen the activities that you are trying to do and collaborate with others, network, and work together to take our fraternity forward. So I would say that you should really consider becoming a member of the committee and join the WFSA. Thank you.
Apologies, everybody. I'm clearly having some technical issues. I am back. Thank you, Sheila. That was an excellent overview of our committee work. And I'll be providing some more information a little bit later in the webinar about the dates for applying for committee membership. But we'd like to go ahead and move on and talk about one of our other very important programs, or actually host of programs. Dr. Sonia Akrimi, who's the chair of our education committee and is a consultant anesthetist with a specific interest in obstetric anesthesia in the UK, is going to be talking about the short programs, the short courses that we do. And as many of you know, we have a lot of short courses. She's just going to have time to give a little bit of an overview of them, but hopefully for those of you who aren't familiar with them, you'll learn a little bit more about them. And for those of you who are familiar with them, it might get you interested in actually getting more involved. So Sonia, I'm going to let you take it from here.
Thank you very much, Faye, and thank you very much for the invitation to speak today. I have served for the last 5.5 years on the Education Committee, and I've had the privilege for the last term to be the chair. And just as Sheila mentioned, it's something that comes with a number of privileges and benefits. I've enjoyed every minute of it. So I really encourage you to think about that, and thank Sheila for her talk. I'm here specifically to talk about short courses supported by the WFSA. First of all, people often talk about short courses and say, well, actually, do these bring value and do these bring long-term change? And the answer here, we believe in the WFSA that these have a significant and powerful impact. And we really support a number of these short courses. The reasons why these work so well is that they are something that can be implemented in a flexible manner. They are practical and they can be run in a pragmatic way that fits around the needs of a local institution and the individual healthcare workers in that need. They can also be contextualized so that they can be adapted depending on when and how they're running. They are often very high impact, or they're there to work to support high impact areas. For example, as areas of clinical medicine where we know that we need support in developing training to improve practice, and that this has got real potential to improve aspects like mortality and quality and safety. And they are scalable. We focus very much on sustainability from the outset, local leadership, and growing faculty to be able to lead these with reduced input from external sources with time. So all of these things combined mean that we really believe that these are powerful educational tools and that their real uniqueness lies in how they can be implemented in a flexible way to meet the needs of the local setting. We're here today to talk about 4 specific courses, and we've chosen these 4 based on them either being WFSA courses or having very close relationship with the WFSA. The first one I'm going to talk about is SAFE. Safe Anaesthesia from Education is one of our older courses, and many people may have heard of this or actually been trained or be a trainer through SAFE. SAFE is a 3-day course that provides training for anaesthesia providers in obstetrics, pediatrics, and other aspects of surgery. It is delivered in a practical and interactive way with a number of emphases on cases and practical scenarios. And we have a number of SAFE courses in the SAFE repertoire. This includes obstetric courses focusing on common maternal emergencies, pediatrics, pediatric cleft, and operating room, which focuses on multidisciplinary surgical teamwork needed for high quality care. And then there are supplementary SAFE courses, including Train the Trainer courses and an online course incorporating e-learning. As I mentioned, this is one of our older courses, and therefore it's one of the ones where many people have been trained all around the world in more than 50 countries to date, with a huge number of people trained as trainers and with experience in teaching through SAFE. And there's been a lot of research as well and evaluation to show the benefits of SAFE and how this impacts care. The next one I wanted to highlight to you is essential pain management. So again, this is another clinical-based course that is focusing on the need for high-quality training in pain. And this is for healthcare workers involved in caring for patients in a number of settings, including doctors and nurses, and it covers acute and chronic pain. In addition to the science behind pain medicine, it also thinks about aspects of communication and managing patients experiencing pain on the ground, empathy, and cultural awareness. And there are a number of allied courses here, including EPM Light, which is for students, EPM Pediatrics, an instructor course, and then there's a free open access online course as well, which really increases the access that people have to this training globally. EPM has been running for a number of years as well, and as such has already been delivered in more than 60 countries and has been translated into multiple languages. The next one to talk about is Vital Anaesthesia Simulation Training, VAST. VAST is a 3-day course that started initially in 2018 in Rwanda and now is being run in more than 30 countries, having trained more than 900 practitioners. VAST is initially a simulation-based course covering aspects of acute emergencies, including in pediatrics and obstetrics and trauma. It focuses on using simulation to help train individuals and teams in non-technical skills, including communication, leadership, and teamwork. And additionally, part of the VAST sustainability model is a facilitator course, enabling individuals to learn to become a simulation facilitator, an instructor course supporting facilitators in then embedding the course in their local region. And VAST also has some allied courses. There is a well-being course, which is a 1-day course supporting practitioners in understanding burnout and burnout prevention, thinking about well-being. And there's a foundation year course as well, supporting anaesthesia training. And then the 4th course I wanted to talk about today is called Inspire Through Clinical Teaching. This is a medical education course, so understanding that for healthcare and for clinical anaesthesia to develop, it's important that healthcare providers are trained in both how to teach and leadership skills. This is an opportunity to provide that training through a 4-day multidisciplinary course, equipping individuals who teach in their clinical environments and elsewhere in developing more skills as an educator. The program has already trained more than 400 individuals globally in a number of countries and has helped establish local faculty in each of the countries in which it is run. These individuals have progressed onto faculty roles and course director roles, again helping to increase sustainability. Inspire has always had a close relationship with the WFSA, but very recently it's become a WFSA course. And as such, now under the leadership of the WFSA, we're working to expand the course, both in the ways that it is run through different languages and supporting different cultures, in addition to changing or adapting some of the teaching content and the structure. So again, it becomes a more diverse course that can be run in a variety of ways. There are a number of new courses that you'll hear about in the next couple of years that are growing at the moment, and this includes another SAFE course, SAFE Caesarean Section, a course on perioperative patient blood management, PBM. There is an intensive care course, and there's a WFSA leadership course, which is due to be launched at WCA 2026. So the final thing is to think about how can you get involved. If you're interested in short courses or finding out more about short courses, a good way to break this down is to think about the different options and get involved. You can participate in a course as a learner and learn from the course in the way so many people already have done. You can teach on a course, or you can focus your interest in embedding a course in your region or developing the course. And each of those have different ways that you can get involved. So if you'd like to participate in a course, I would recommend contacting your member society or contacting the WFSA directly. And there's a contact here for Laurie Barnes, who works with the programs team. Similarly, there are some opportunities for teaching. Teaching opportunities can be focused on people who are already embedded in the course, either as a participant or people who are able to have a long-term relationship with the course. So I would recommend speaking to the individual courses about that if you'd like to become a teacher. Again, for VAST, you can do that through this email address, and for Inspire, you can contact me through my email address here. Otherwise, again, it would be for Laurie. And then embedding a course in your region or for course development, for example, a really useful skill that you can bring is skills in different languages to help grow a course, or networks in your region. Again, I would contact these individual links. So for FAST, there is a website, an email address, and an expressions of interest form. For Inspire, you're welcome to contact me, and for all others, for Laurie Barnes at the WFSA. Thank you very much for your time.
Thank you very much, Sonia, for your presentation and to explain to us the so many options of the course that we have and how we can contribute and participate on those courses. So thank you very much. And following our program, I would like to introduce Dr. Anju Grewal. Dr. Anju, she is our editor-in-chief of the Anesthesia Tutorial of the Week. Dr. Anju is a professor and the head of the Department of Anesthesiology at All India Institute of Medical Science in India. And Dr. Anju will talk to us a little bit about the Tutorial of the Week, which is a very important learning resource that we have on the WFSA. Thank you very much, Dr. Anju. So the stage is yours.
Thanks a lot, Dr. Louis, and everyone for giving me this opportunity. Very good evening, good morning, and good afternoon to all our viewers. We'll dive straight into how to get involved with ATOTW. Now, first look at what is ATOTW, and has been amplified before me, that it's a self-directed learning and continuous medical education resource. And in consonance with the vision and mission of WFSA, it aims to empower anesthesiologists to deliver safe, high-quality anesthesia services across varied clinical settings through a simple, freely accessible education. This is published on a bi-weekly basis and is translated from English to Chinese, French, Portuguese, and Spanish. All tutorials are peer-reviewed, and published ones are emailed to our subscribers. So if you're a subscriber to us, you can subscribe to us going on to our website. And in addition, they're freely accessible to download at the WFSA website. The most important interesting highlight is an online quiz to facilitate a CME accreditation certificate that you can download and submit to your member societies and access it, and you can gain some credit points. One of the biggest testaments to credibility of ATOT as a valuable global educational resource has recently been posted in our network by Dr. Adrian Gelb. BJA has come up with a book review on Miller's Anesthesia. And guess what? Anesthesia Tutorial of the Week highlights as one of the education sources which provides more context-specific insight. So it does have a huge, immense place amongst all countries globally for us. And I would credit this accolade to my predecessors, which started off in 2005 with Ian Wilson, went on to Richard Hughes, and then Nick Boyd, Mettany, and Dr. William Francis Powell. All of them have done immense contributions to this, the kind of educational resource that you all see it is their hard work. And this has been coupled with a brilliant and a vibrant set of editors that are there on the board currently. And they are very well managed by our managing editor, Ably and Rosa. She is an asset to all of us. And we would actually, all of us, on behalf of all of them, I invite you all to volunteer to author, review, or translate for ATOTW. And for authors, I would suggest that how would you go about, writing for ATOTW is a small roadmap that I would like to present to you all. It will be nice and useful to perform an advanced search on our ATOT website to identify a focus topic. Currently, we are looking at updating our tutorials, which have been published 5 to 10 years. So look at the topic of your core area of interest and see if there is recent more evidence available than that has been mentioned in the tutorial. And once you have identified a focus topic from which you think needs an update, then you should identify a senior supervising co-author from your domain. Now, one word here is a good suggestion is that if you belong to a high income group, it will be nice to have an expert coming from a middle income or a low income and vice versa. So we have perspectives from and collaboration across the entire world in all settings, clinical settings, and it becomes a pretty useful tutorial for all kind of clinical settings. And then once you have identified and written up a draft outline of your proposed topic, please email it to us at this email, atotw@wfsahq.org. And then the editor-in-chief with the section editors will review the topic and the draft outline. And once accepted, the EIC will email a link. This is a link that we have recently moved to an editorial manager. However, we are taking in manuscripts that have been accepted once the proposed topic and the draft outline is accepted on our on our email. So then the EIC will send you a link to submit the manuscript on the editorial manager. And once you do submit your tutorial on this editorial manager, then we will assign you a section editor and a primary editor who will mentor the authors in writing the tutorial. So this is a process and has specific timelines, and I believe pretty user-friendly and a very good hand-holding. In addition, we would also like you to join us as subject expert editors and reviewers. So if you're interested, please send us a brief resume with a personal statement why you think you would fit the job at the same email ID. And do join us in updating our old tutorials with a current team of editors. We have a hand-holding process, and then we graduate you gradually to subject-specific editors eventually when we're sure that you've understood the entire process. And having said that, I would actually aim that in the coming years, we have a user metrics which shows that the entire globe is as green as the United States and India. And for that, I invite all the supporting institutions and member societies to become advocates and ambassadors of ATOTW. Thank you so much for your time, and we'll love to take questions. Over to you, Louis.
Back to me. Dr.
Okay.
Anju, that was fantastic. I think for those of you who like to write, I think Tutorial of the Week is just such an amazing opportunity for you to work with a senior level trainee in partnership with a faculty member to really put together a tutorial. And like Dr. Anju mentioned, there are opportunities, especially for specific topics, to have folks as authors from both a higher resource setting with working with somebody from a lower resource setting, so that the tutorial actually represents how to manage a condition in both settings is just a great resource. And it's not only a great resource for our community, but also for the authors and the ability to work with somebody from a setting where they might not normally be able to work. So thank you for doing that. Our next speaker is going to be Professor Chris Lundgren, who is the current editor-in-chief for Update and Anesthesia. She's also the head of clinical governance at the Wits Donald Gordon Medical Center in Wits, South Africa. And she's been the editor-in-chief for Update for a while now, so she'll have lots of words of wisdom for everyone, for our audience here today. So thanks, Chris, for doing this.
Thank you, Faye. And good morning, good afternoon, and good evening to our colleagues online. I like the question from Dr. Black in the Q&A saying, I'm nearing retirement and what could I do, with my time? And I think that is a wonderful question, and I see Faye answered it. But for me, I think one needs to get involved in, I've been in anesthesia since 1979. So yeah, you can all work out how long that is, but it's pretty long. And I was involved in clinical anesthesia, and then I did a degree in clinical governance and bioethics. And so I've slightly changed careers, but anesthesia is my first love. And I honestly believe that ethically, if one looks at not necessarily your clinical skills or anything like that, but I think ethically, having been in the profession for a long, long time, I really think we need to give back to our specialty. And you can give back, to your specialty by either getting involved in your own national society and at the same time learn about the WFSA and get involved in the WFSA. And I'm not just talking. I've been involved on a committee or part of the WFSA since 2002. So that's 20 plus years. And you have no idea what skills you might have or what you might add to the mix, but we can all contribute. It doesn't matter how young you are, how old you are, if you're nearing retirement, what phase of anesthesia you're in, you can always give back to your specialty. Getting back to the question and Dr. Black's question, do I have the time? I think when one nears retirement, you do have time. And even if you don't have a lot of time, one can organize one's time. And just think about, do you have any special skills that you can share with other members of WFSA, with other members of the greater anesthetic community? And do you have any niche interests? And getting back to Anju's talk now on ATOTW, do you have any passions in specific areas of anesthesia? Can you write an ATOTW on it? Can you write an article for the UIA? So I think everybody needs to think about, why should I get involved? And do I want to get involved? And once you've decided you want to get involved, don't hold back. Contact our secretariat and get involved in your own society in WFSA. So updates in anesthesia, fortunately, we don't have the deadlines that ATOTW has. And for the last few editions, we've had themed editions. And our last one was published fairly recently, and it was on workforce well-being. And I know some of the authors are online, and I'd like to thank them again for their contributions. And so as I say, we have themed editions. They're all online. They used to be printed, and the printing costs were exorbitant. So they're all online. We're having 3 this year, but we only had 1 last year. So it averages out at approximately 2 editions a year. We also accept standalone articles on any subject in anesthesia. They go through the same peer review process, etc., and they get published as standalone articles online. So just because you would like to write an article on something that's not part of our themed editions, it doesn't matter. We will publish that as a standalone article online. And there are lots of ways of being able to get involved in the update in anesthesia. As an author, we always need reviewers. And I feel sorry for my ex-trainees in South Africa, because I know what the areas of interest are, and in other parts of the world, but I know what the areas of interest are. And if I'm desperate for a second reviewer for an article, I usually ask them, and they perform the review. But we always need reviewers. If you'd like to get involved in the editing process, you will be more than welcome. it was fairly onerous with this past edition, but I think we've sorted out our teething problems, and hopefully it'll be smoother going as we go forward. Rosa here is our managing editor, and she's made a world of difference to getting the UIA published. And we always need translators. One of our previous editions was translated into Vietnamese because at one of the General Assemblies, we had a volunteer who wrote to me and said, I'd like to translate it. And it was so exciting. So it doesn't matter what part of the world you are from. If you'd like to translate just a single article, a standalone article, or an edition of the journal, we welcome it. That is the editorial manager contact to submit as an author. And if you have any queries, please contact Rosa in the Secretariat. As I say, she's our managing editor, and she can put you in contact with whoever is necessary. And getting back to the question about nearing retirement, Dr. Black, I agree with Faye's answer to your question. The mentoring, nobody's mentioned the mentoring program, but it's a fantastic program. Louise has put the link in the chat, and we've just started the next application process for mentees and mentors. And if you're nearing retirement, I'm sure you can contribute as a mentor. So thanks very much.
Professor Christine, thank you very much to explain for us a little bit about the updating and anesthesia. Our scientific journal, it's a great journal. It's a huge amount of work. So thank you for working as an editor-in-chief. And as you mentioned, we need a lot of help. So you can write an article for the journal, but you can contribute as well in reviews and others roles. So thank you very much, Professor Christina. And following our program, our next speaker will be Dr. Nicolas Sergi. Dr. Nicolas, he is the consul and the regional representative of the Latin American in the WFSA. Dr. Nicolas is the Secretary of Records and Communications in AFAR, which is the Argentina Federation, and Secretary of Community Service Resource Association of Anesthesia, Analgesia, and Resuscitation of Buenos Aires. So thank you very much, Dr. Nicolas, to join us and to share a little bit your experience as a Latin America representative inside the WFSA. So thank you very much.
Hi, everyone. Well, I'm Nicolas Sergi, as Luis presented me, and I serve as one of the World Federation regional representatives at the Council. I'm very happy to be part of this conversation about how to get involved and why regional representation is so important. So first, what is to be a regional representative? In simple terms, a regional representative is the link between the World Federation and the anesthesiologists, societies, and professionals in a specific part of the world. Our job is to keep two-way communication going, bringing information, priorities, and ideas from the region into the Council, and then sharing back World Federation plans, opportunities, and resources with the local societies. World Federation has several regions. For example, Africa, Asia, Europe, Latin America, North America, the Middle East, and Oceania. Each has unique challenges, strengths, and priorities. Having representatives from every region ensures that no area is left behind and that the Federation stays truly global. Because of this variety and the specific idiosyncrasies of each place, it is essential for regional representatives to be deeply familiar with the context, the needs, and the priorities of the countries they represent. In my case, I come from Argentina. That's a country that is recognized as a leader in institutional activities, training, and professional advocacy. I also share my role with Vicente Fonseca, who is the vice president of the Brazilian Society of Anesthesiology. And Brazil is one of the largest countries in Latin America, with more than 200 million people and over 20,000 anesthesiologists. This combination of perspectives and experience allows us to represent the region in a balanced and comprehensive way. And I believe that together we make a strong contribution to the development of anesthesia in Latin America. But what are the goals of this role? The main goals are to ensure, The main goals are to ensure that diverse perspectives are part of every discussion and decision at the Council, to help member societies feel connected and informed about what the World Federation is doing, to promote engagement in education, advocacy, and research opportunities, and to support collaboration across borders so we can advance patient care together. My role on the Council has involved several aspects. I participate in meetings and discussions, I share updates about my region, I vote on matters affecting the Federation, and I act as a point of contact for societies or individuals who want to engage more actively. In many ways, it's about listening, communication, and creating bridges. For example, in this role, I contribute to develop of the global survey of anesthesia training that it's about to be launched. I have also helped to facilitate new fellowships opportunities in Argentina, strengthen collaboration within Brazil, and support connections between colleagues to enrich the 50th Argentine Congress of Anesthesiology. In addition, we have worked to strengthen ties with Uruguay and Chile and promoting greater exchange and cooperations between them. Why is regional representation so important? Because anesthesia practice, resources, and needs can look very different from one country to another one. Regional representation helps make sure the World Federation vision and activities reflect this diversity, and it gives every society a voice in shaping the future of our specialty globally. Of course, there are a lot of challenges. Sometimes it can be very hard to keep every society engaged and informed, especially when there are differences in languages, priorities, or capacity. One of the main challenges is also the size and diversity of each region itself. Ideally, a region representative will be able to visit every country regularly to understand local realities firsthand and build stronger relationships. However, the costs involved are very, very significant. And in practice, we have to do the best we can with a small budget that we have. I really encourage anyone who is interested to get involved. It's incredibly rewarding to contribute beyond your own country, to learn from colleagues worldwide, and to be part of something bigger that is helping strengthen anesthesia everywhere. Thank you very much, and looking forward for any questions.
Thank you. Thank you, Nicolas. That was fantastic. And I just want to commend you for all of you where English isn't your first language and you're speaking in English. For me, if I had to speak in Spanish, it would be a disaster. So very much appreciated. And I think just hearing the perspective from, it's not the traditional way that you think about getting involved, but really it's, again, that regional representation. All of our regions have representation and they're supposed to speak on behalf of all of the societies in that region. It's a really hard thing to do because, as you can imagine, some of the regions are quite large and the countries have very different needs. We want to finish our presentations or our formal presentations with giving Francis Peel an opportunity to talk about advocacy and communications. He's the current head of advocacy and communications for the WFSA, and it's an area that I think we kind of forget how important advocacy is in the work that we do. It's as important as any of the committees and any of the other work we've talked about already. So Francis, I'm going to let you have this opportunity to talk a little bit about your group.
Great, thanks very much for that, Faye. I'm just going to share my screen, and hopefully, if you could just confirm you can actually see my presentation. Can everyone see that?
Yep, we're on. It's not in presentation mode quite yet.
We
are
just getting there. There we go. Lovely.
Sure, perfect.
So thanks for that, and hello everyone. unlike the other speakers on this call, I'm afraid I'm not a volunteer. I'm employed by WFSA, as Faye was saying, to communicate and advocate the expertise and sort of on behalf of the board, the council, the committee, and ultimately our member societies. Today, essentially, I would like to look at three ways that potentially you can get involved in helping to amplify our specialty's voice. There's a lot to go over, so I'm unfortunately going to have to whiz through it. But I think the ways we could potentially look at is, okay, what are ways that you can sort of support engaging at national and regional level to strengthen policy and planning? Then we're going to have a look at sort of what are ways that you might be able to support WFSA's campaigning or campaigning activities. And then the final is like, what are the existing channels that we can use to just champion the global anesthesia community? So if we start with the first one of those is, as Louise mentioned at the beginning, WFSA is in official relations with WHO and ECOSOC. What that essentially means is that we are the go-to expert on all issues of anesthesia. And as part of that, we attend, as you know, global and regional committee meetings to advocate for anesthesia within the global health systems. You know, the agendas for these meetings can be diverse and cover a whole range of issues, but essentially what we've tried to do, and I know we saw this messaging before, but I think it's worthwhile repeating, is that our messaging is consistent, that as the agenda items change, our communication with them is clear. And as well as global events such as the World Health Assembly, which you see there, our former President Wayne making a statement at, we also send delegates to regional events. So we attend all 6 WHO regional committee meetings, as it brings us a bit closer to policymakers and decision makers. And a key component of those meetings are the informal sort of bilateral meetings that happen at the coffee, whilst getting coffee, or while you're having lunch, or at the side of meetings where you have a conversation with country delegations or potential partners or individual stakeholders who could influence your health policy and practice moving forward. Now, this brings me to the components of where I think individuals potentially on this call can get involved. So I think looking at, whilst we engage at the regional and global levels, it might be that you are better set to engage at the national level, working with and through your national societies. You may well have your own connections with ministries of health and other policy and key stakeholders. If you don't have these, are these things that you can develop to help move the global anesthesia conversation forward? We can obviously provide support you with global policy briefs, advocacy materials, and toolkits and advice. And within those meetings, maybe there might be opportunities to meet with your Ministries of Health delegations or your contacts to engage our leadership in those conversations. A second area that we're looking at is how we can engage around campaigns. Now, again, these campaigns are developed and directed by the board, the council, the committee, and ultimately member societies. And these provide an opportunity to engage on a specific issue. They can run from annual long events such as the annual theme, which this year is looking at anesthesiology and health emergencies, and covers a year-long series of webinars, publications, and social media campaigns. And then there are much more sort of specific, less time-bound ones, such as some of the declarations which we ask member societies and individuals to sign up to. This could be around patient blood management. We have a number around access to analgesia and pain medication. And then there's a one which we do, a declaration or campaign we're running in partnership with Smile Train and Lifebox, which is looking at, can we close the capnography gap? Can we ensure that these life-saving machines are available in low resource settings? Alongside that, we also run, as hopefully you know, sort of international days where we sort of raise the profile of anesthesia. So for example, I hope you're all actively engaged in World Anesthesia Day on the 16th of October. This follows the Our annual theme will be looking at anesthesiology and health emergencies. And again, there's webinars, there'll be social media activities, there'll be blogs. And likewise, in the month before that, there's a Global Patient Safety Day, because obviously anesthesiology and patient safety are so closely aligned. What are the ways that as individuals you might be able to get engaged then? So I think the first protocol is for those wanting to campaign on behalf of the global anesthesia community is read and acquaint yourself with the ongoing materials. A lot of the activities, this is not a one-way street. So essentially, for these campaigns to work, we look to be collaborative and work in a sort of reciprocal way with the people who we support and engage with. So get informed, find out what the campaign is relevant to you. Have a think about how you might engage with it, or you might work with it, and then crucially let us know so then we can provide and support you with images, social media materials, logos, advice. If there's, for example, on a given campaign, you might want to organize a webinar, let us know again, so we can both promote but also potentially identify speakers who we can slot into your agenda. I think the engaging with our selective network, so we can cross promote each other's activities and just raise the good standards and practices that we're doing. Finally, campaign work doesn't have to be hard or time consuming. To create strong messaging around safer, more accessible, stronger anesthesia care, many of the tools we need are already at our fingertips. So essentially, WFSA, for example, we reach approximately 80,000 people through our various social media channels. Now, with your networks and channels, we can reach much more than that as a global community. And ways we can do that is potentially you can tag WFSA within your social media things, and then we can repost and engage and build a conversation around that. We're always looking for content, and so contribute content for blogs or posts that we might engage with. And then on behalf of my my comms officer Jyoti, she's very keen on sharing behind the scenes moments. So this is showing the real impact of anesthesia care and anesthesia work. So whether that be your work in the OR, obviously with patient privacy mindful, or during teaching and training, is engaging with us and working at actually how can we amplify each other's voices. So if there's three takeaways from this short presentation, I would say one was use your connections and networks to amplify the voice or that of us as a whole community. Drop a line to us or engage with us to see what resources we have to support you in the activities. And let's amplify through our existing communication channels. We don't need to rebuild the wheel. So there's my contact details at the bottom. Please drop a line, and yeah, I look forward to collaborating with you. Thanks very much.
Thank you, Francis. That was fantastic. I think you can see through all of the presentations that we've had today, there's some really key themes, or the two key themes I like to think about are engagement and collaboration. And we really rely on our broader community to do all of the amazing work that we're doing. We couldn't do it without you. And just to remember that we're a volunteer organization, so we do have a secretariat of folks like Francis and others who really help to support the work we're doing. Francis, and then Rosa, who's kind of behind the scenes putting together the webinar. But otherwise, all of the work that we've been describing is really done by volunteers made up of people like you. So I do want to take a moment to talk a little bit about the upcoming committee application process that really just went live, and it's an excellent way to get engaged. I know that we spoke about all the different committees that exist, and if there's an area specifically that's of interest to you, I would suggest you go to our website, and I put that QR code right there and also the link where you can learn a little bit more about the application process. The application period runs from July 1st to August 31st, so you have plenty of time. And basically, you do need to have some type of experience in the area and interest, obviously. And you can either self-nominate yourself or be nominated by your member society. But even if you do self-nominate, you will need the support of your member society, and they need to be in good standing. Because as I've mentioned several times in the chat, and this is a really common place of misunderstanding among the greater anesthesia community, we are not made up of individual members, but the WFSA is a society of societies. So you are a member of the WFSA if you're a member of a WFSA, a member society that's a member. And then just to let you know, all nominees will be informed of the outcome by November 14th. And then the new terms, which are 2 years in length, start in April at the WCA in 2026 in Marrakesh. So that, if you have any questions about that, feel free to do so. And now we're going to kind of turn it over to some question and answers. And Luis and I are going to manage this together. Sorry about that. I wanted to start off, I've been trying to answer a lot of the question and answers in the chat, but there's one that's come up several times, and I realized that we didn't bother to present on the mentorship program. And it really is an amazing opportunity both to present as a to participate as a mentee or as a mentor. And one of the questions that came up specifically was about whether the folks who want to be a mentor get any training. And I thought I would let Louise talk a little bit about this program and also a little bit about answer to that question because I can't do it. Louise, take it from here.
Thank you very much, Faye. It's a great opportunity to talk a little bit about the mentorship program. Professor Christina here, she's one of in the working group of the mentorship program. And one of our leading, it's Dr. Juliet Hu from the UK. The mentorship program, we are starting the second year now, enrolling the mentors and the mentees. The first one was in 2024 and 2025. It was a great successful program. We had more than 300 applications. And now we open a new application in July 1st and we'll close in July 31st. So we have more 2 weeks who are interested to apply as a mentor or as a mentee. What is important to mention is, first of all, the application. The application should be it's an online application through the website. I put the link here because we have one link that you can find the form for the committees, for instance, for the mentorship program and so on. So you can click there, you can fill out the form, and you need to submit 2 documents. The first document, it's your abbreviated CV, no more than 3 pages. And the second document, it's a motivation letter. It's very important to write a good motivation letter because unfortunately, we are not able to match all the submissions because we depend on the number of mentors and the number of mentees. And today, the mentorship program can do it in 4 different languages: English, Spanish, French, and Portuguese. So it depends on the number of the mentors and the mentees to match the mentor and the mentee. To be a mentor, what is necessary to be a mentor? You need to be a physician anesthesiologist with at least 5 years of experience. So if you are early career anesthesiologist, unfortunately, it's not possible to be a mentor, but you can apply for a mentee. And you need to be a member of your member societies because as Faye I pointed out, the WFSA is a society of member societies. So if you want to apply, you should be in a good standard with your national societies. And to be a mentee, you need to be a physician anesthesiologist and as a member of your national society. Unfortunately, up to now, we don't have a course to prepare a mentor and a mentee. But on the next World Congress of Anesthesiology in Marrakesh, we'll have a workshop. And at this workshop is exactly to discuss how to be a good mentor, how to engage your mentee, how to have a good mentoring process. And this will be in the World Congress. And it is a great idea, maybe Professor Christine, we can work on that to do an online course for a mentor and a mentee, because for a good program, you need to know your role, your duty as a mentee as well. So if you are interested, please apply for the program. We'll be very happy. During the next month in August, we will see all the applications starting the match process, and we will receive a feedback from the WFSA if you were met and if you start on the program. And at the end, a lot of people do this question as well. At the end of the program, all participants get a certificate. So as a mentor or as a mentee.
Thank you, Louise. That was great. If anybody else has any more questions about the mentorship program, please put it in the Q&A. I'm going to address two quick questions.
I think, sorry, Faye, Professor Christina, she is with the hands up. Probably.
Oh, I don't see it. I'm so sorry, Chris. Chris, go for it. I apologize.
That's
You
fine.
were off the
Thanks.
screen.
I'm off the screen, sure.
I'm sorry, not just mine. Mine
And
is
it's
not.
only 5 o'clock.
Sorry, I apologize.
No, what I wanted to add to what Louise said is that, you know, you can be an academic mentor, you can be a career mentor. There are different roles of mentors, and we'll obviously cover that at WCA in Marrakesh. And I think leading up from that, we'll produce a course online. And so you don't have to be in a high-powered academic situation to be a mentor. I mean, you can mentor people on leadership, on, as I say, career. There's an awful lot of roles for mentorship. So I encourage people to apply. Thanks, Faye.
There is a in the chat. Chris, if you could just look in the chat at the last question, I'm going to let you answer that in the chat. I do want to quickly address two quick questions that came up. One is around publishing. And I think there was a question about, you know, if you're from a lower middle income country and you want to write, where to publish and how to do it because of the economic constraints. We do work very closely with Anaesthesia and Analgesia. And so if you submit an article to their global health section, and it is accepted, it will be open access. There is no charge. So there are journals out there where there are no charges. Many journals now do have a charge, especially if you want to make it open access. The other option is you could always submit it to Update in Anaesthesia, which again is open access and there is no charge. I agree. I wish they were all open access, but they're not. So that's kind of what I can tell you right now. I'm a huge proponent for it. I'm always advocating for it, but it is a challenging situation. But again, ANA, if you submit to their global health section and it is accepted, it is considered open access. There are no fees. And then the other question really quickly was how can we expose newly admitted postgraduate students to our resource material? They are all online and they are all open access and free. So all they need to go is to our learning library on our website and everything is there and free, including access to all of our amazing articles on Update and also all of our ATOTW tutorials. We are going to require that folks register to have access, not because we want to make a barrier, but we want to know who you are. We want to know who you are and where you work and potentially any feedback you might have so we can just make these resources better and more relevant. So please don't feel like we're collecting information to do anything with it other than to really know who our learners are. And then I have a question for Sonia that's an interesting one. I know it's an area of interest for you. There's a question about, does that WFSA have anything to offer medical students who are interested in anesthesiology? Sonia, I know you have a particular interest in the undergraduates. Thought maybe you might try to tackle that one.
Thank you very much. So we are really interested in working with medical students, and we do work with medical students quite regularly. The way that we work with medical students, so we have a good relationship with the International Federation of Medical Students Associations. We're a very similar organization to the WFSA. We do have some resources and courses that are either bespoke for medical students or are similarly useful to medical students as they are anesthesia providers who are postgraduates. For example, we have the PM Light course, but also some of the ATOTW and other areas and other learning resources are useful. We can also, if you contact us personally, we can offer you some guidance into what might be useful. And we do have opportunities that come up where we work with medical students on some of our programs and our projects. And we actually have quite a good track record of where we've involved medical students in, for example, education development or evaluation work. And we've been able to share our experiences and support them in building their skills in that. So although our resources tend to be focused on supporting people who are giving anesthetics now, we do actually have opportunities surrounding that for other individuals and students. And we really enjoy working with students. We enjoy being contacted on a personal level. So if you are a medical student, you're considering anesthesiology, I think it's something that everybody here would recommend. And also, if you'd like to learn more about the WFSA, get in touch with us and look up the IFMSA as well. And we'd be really pleased to give you some guidance.
Thank you, Sonia. There's another question about the mentorship program that it's an interesting question that I want to put out to the group again. And Chris, you or Louise can answer this because it's really about peer-peer mentorship, which I do think is really important. And there's a trainee who's got 5 years experience. So obviously it's a long training program, probably my bet in the UK, who wants to know if they could serve as a mentor. And I actually think that's a great question because there is value in peer-peer mentorship. Chris and Louise, how are you addressing that?
Grace?
I was going to say important person first.
So you, but before I answer that, if Faye allowed me, I would like just to a quick mention about medical student, medical residents. Can I, Faye?
Yeah, sure. Go ahead for that. And then don't
Yeah.
worry, guys, we'll get to the other questions that are out there around the committees. I see them. I just was grouping the mentorship ones back on here. Go ahead.
Only to finish that, but the WFSA started last year a working group of early career anesthesiologists, especially because we see that a lot of young anesthesiologists and medical residents and students as well has interest in the specialty. So Nicolas Sergi is here. He is one of the member of this working group. We probably at the end of the year, we have more news because it's not launched yet. We are starting the early career anesthesiologists with a global survey that Nicolas is the leading of this global survey that will be published in the couple of weeks, I believe so, because we are just finishing some points. And this program will produce a lot of materials for those in an early career. Unfortunately, medical student is not the target. The target is the medical residents and up to 5 years after finishing the medical residence. But for sure, we can discuss for medical student as well. So we hope the WFSA brings some news about that. Regarding the mentorship program, yes, we had a long discussion about mentor and mentee. Last application, we have a few colleagues that would like apply as a mentor, but he was still on the medical resident or was too young. So we put as a 5-year of experience after finish the medical residence to apply as a mentor. And so as a mentee, any stage of career. And as Christine pointed out before, it's very, we have a different tracks. We don't need to be an academic, but for instance, clinical skills or leadership. During the application, you can you can check in what track do you like to enroll as a mentor or as a mentee on the program. But nowadays, the application, it's there is another question. There was another question. It's for a physician only up to now, and as a mentor after 5 years finish the medical resident, and as a mentee for any stage of your career.
Good. Thank you very much. Sheila, I'm about to ask you a question. Is this about the mentorship program? Because I'm about to get to you actually for some committee questions. Is this about something on the chat or is this about the mentorship?
No, it was the question that was asked about how much time commitment would a
I was going to
committee
get to
member have
that. Yeah, well,
So
I'm kind of divvying these up. So just hold tight. I'm getting there. Because actually, there's two questions about committees that I was going to kind of give to you. One was about the time commitment it takes to be on a committee, and then also are residents allowed to apply for a committee? And I'll let you kind of answer both of those.
Right, thanks for that. So again, the time commitment is variable because it really depends upon which committee you're on and how active that committee is. The committee usually meets at least once in 2 months, and these are online meetings, not in person. So unless it is during a World Congress. So these online meetings usually last for an hour. And then depending upon the activities of the committee. So some committees are very active, and if you volunteer for, and then again, the whatever work is distributed among people. It's not that one person has to do, or you have to do all the activities, be part of all the activities. So it's not a lot of time, but if you're very enthusiastic and passionate, and you can contribute much more to the activities, it really depends. So I would say it's variable, but definitely you'll need to attend the meetings. That's least that will be required of you, and also depends on the time that you have available. So it's not much time, and you don't have to worry about that. That a lot of time will have to be given for the committee. About residents, when you say, do you mean postgraduates in anesthesia? I think it's qualified anesthesiologists, but please correct me if I'm wrong, because as far as I know, it would be qualified anesthesiologists, people who have completed their training. But is it open also? It is open also for,
I think it's going to depend on who
anesthesiologists.
applies because you're competing against trained people. I think the
Yes,
limit for
right.
the challenge for the trainee is having the experience. But I think if they're experienced trainees in a specific area, that by all means they should feel like they could apply. And we can always also we've talked about even doing some ad hoc for trainees specifically, but get engaged. Let us know. So I'd say apply.
Right. It's a good way to start early, actually, and get, engage with WFSA even before you are a qualified anesthesiologist. Yeah.
Yeah, exactly. No, so thank you, Sheila. That was great. I think Daniela, our current president, also wanted us to make sure to comment that we do partner with the IFMSA, which is the International Federation of, I got to remember the whole, Sonia, help me on this one.
International Federation of Societies of Medical Students, I think.
Yeah,
Medical
and
Students.
we partner, the WFSA partners with them because they came to us to help with a handbook when people are doing their anesthesia rotations, some guidance on some guidelines that should be available for faculty doing these. I know, Sonia, you were engaged in helping to review that. So we do work with medical students and medical student organizations. So yeah, that's the answer to that. I'm looking for any other, I think we've addressed all of the questions. For our panelists, is there anything after all of that's been discussed, anything else that any of you want to bring up? We've still got about 10 minutes. I'm happy to bring something up or let people go early. Anybody else have anything else they want to add? Oh, Sonia.
I think I would just share again that I think all of us here have had a fantastic experience with the WFSA. We've really enjoyed meeting each other, networking online and face-to-face. We've got some really strong relationships with new colleagues and new friends through our experiences. And personally, I thoroughly recommend involving yourself in global health and shared learning. And I thoroughly recommend this organization. And I think other people on the panel would agree with me. Everybody's nodding, but I know how passionate they are as well about this work. So I think it's a shared message. So thank you very much.
Thank you, Sonia. It has come up several times in the chat again about how to apply for a committee. We've talked about it several times, but just in case you had to zone out during that part of the presentation, which happens, there is on the WFSA website, there is a link to the application. Applications are open. They're open through, is it the end of August? Now I just forgot the last date. I think it's through the end of August. You can self-nominate
31st
or
August.
yeah, thank you. Or you can have your member society nominate you. Your member society does need to be in good standing. So please, if you're interested, go to that website and take a look. I think it is very informative. And Luis, I think I'll let you do the wrap up. How does that sound?
Perfect. Thank you, Faye. Thank you, everyone. But first, I would like to thank you, Rosa, to organize this webinar. And thank you, Francis, and the all WFSA team for this amazing work that WFSA is doing. So thank you all for joining us today and for your commitment to advanced anesthesia around the world. Every day, anesthesiologists quietly save lives across the globe, right? And we work behind the scenes, but what we do matters deeply. So at the WFSA, we believe that every anesthesiologist has something valuable to contribute, as we saw here during this webinar. No matter your background, no matter your country, your stage of career, if it's in training or after the training, whether through committees, education, advocacy, the mentorship, your voice matters. And this is important. This is your federation. And this is your opportunity to shape the future of our specialty at a global scale. So this webinar is to invite you to get involved, to apply a committee, write the tutorial of the week, mentor someone, or be a mentee and learn alongside colleagues abroad. So share your knowledge, your passion, together with your member society and with your regional session as well. Stay engaged in the WFSA. Together, we can ensure that safe anesthesia is not a privilege, but it's a right for every patient, everywhere. I will leave my email now on the chat, so I'll be more than happy to answer any additional questions. I saw that Faye put her email as well. Please send an email to us with any other questions, and we will be very happy to answer your questions. The future of the global anesthesia is being right now, so let's write together. So thank you again, and we look forward to welcome you into the WFSA community. Thank you to each panelist. Thank you for everyone that joined us here in this webinar. And thank you, Faye, to be the chair of the webinar with us.
Oh, you were my co-chair. By the way, this is our reminder that we're supposed to tell everybody, please join us at the World Congress in Marrakesh next April. If you've never been to World Congress, it's an amazing experience and an amazing experience to get engaged. I would highly recommend it. And it's a lot of fun.
We hope to see everyone in
Yeah.
Marrakesh here.
Thanks, everybody. Take care, okay? And have a lovely day. Bye.
Thank you.
Bye.
Bye-bye. Thank you very much.